Good morning from the 17 Newsroom. Good to have you with us. I'm Maddie Jansen, and we're breaking into programming this morning to bring you a live update from county officials on the coronavirus pandemic here in Kern County. We're going to take you live to the county administrative building in just a few minutes, where we will hear from county officials and public health officials about the latest cases and plans for reopening and guidelines and restrictions around the county. But right now, let's talk about the numbers that were just released about 10 minutes ago. Let's take a look at these. 69 new cases were announced in Kern County and 10 new deaths were announced today. All but two of which were in August. So 2 of those deaths happened in September. The rest happened in August. So again, as deaths and cases are reported, they are attributed to the month they were either diagnosed or that person died. And it sometimes just takes a while for that data to get relayed to the Kern County Public Health Department. Our death toll so far in Kern County is 307 since the pandemic started. And right now, 159 people are being treated in local hospitals. That number is, again, lower than we've seen in several weeks since about late June. So that is one of the metrics that county officials and state officials watch to determine when and if Kern County can move up in tiers. Again, there is a 4-tier system right now across California for reopening. Let's listen in now. This is Megan Pearson, County Chief Communications Officer.
If not, you can go to Kern County Fire, their website, and search Ready Kern, and you'll have all the information about how to sign up. The other resource that I would encourage you all to participate in is Smart 911. You can go to smart911.com and sign up. It's a vehicle that allows you to register all of the individuals who live in your home, to share important information so the 911 dispatchers know who's there and if they have any special needs. It also allows you to log all of your animals, so you can imagine in the case of an evacuation, that information would be very helpful to our first responders who are trying to get people out and find out who's in their homes safely. If you're looking for information about the fires that are burning closest to Kern County, you can check the U.S. Forest Service Facebook pages. So the Creek Fire is burning in the Sierra National Forest. Their Facebook page has a daily update. We have a lot of residents who have homes up there, and I would encourage you to check that update. It happens every night at 7 p.m., as well as the other Forest Service pages that have fires burning. So be sure to check those. And with that, I'll turn it over to our Director of Public Health, Matt Constantine.
Thank you, Megan. Good morning. This morning we are reporting 69 new cases in Kern County residents and unfortunately 10 new deaths that are attributable to COVID-19. The state has made changes to the monitoring program. We've mentioned this in the past. The county data monitoring program has been replaced and updated with a new structure that measures the county's performance in 2 specific areas. These are similar areas that we were using before, but now we are just using these two areas. This is case rate, and this is the average number of new daily cases now, averaged over 7 days, with a 7-day lag, and percent positivity. That's the number of individuals that are testing positive. That's averaged also over 7 days with a 7-day lag. And the state now runs this data once a week and then reports out on how each county is doing based on those 2 criteria. The state has established 4 different tiers. We are in the highest tier, or tier 1, which has a purple color associated with it. In order for us to move into tier 2, our case rate needs to be below 7, and our testing positivity needs to be below 8. As of the last time the state ran the data, our case rate is 7.8 and our testing positivity is 9.9. So we are close to that limit and close to moving into the next tier. Those numbers have trended down over the last couple weeks. The state, however, on Monday announced a new adjustment to case rates that they are going to apply, and they did apply beginning Tuesday, for counties that have testing that is below the state average. They adjust our case rate. It's a negative offset. So Kern's average testing rate per 100,000 is 126. The state's average is 217 per 100,000. Because we are testing at a rate that the state believes is low, and it is lower than the average, they are artificially adjusting our case rate from 7.8 to 9.2, which puts us further from meeting that next tier, Tier 2. So the county needs to increase testing. The calculation that we've performed is an additional 877 tests a day on average to achieve the current state average and to have the ability to remove that adjusted case rate, that offset. So with that, I'll turn it over to Ryan Alsop.
Thank you, Matt. Good morning, everybody. We've got 30,440 residents, 69 new today, as Matt said, that have tested to date positive for COVID-19. 98% of that number are people who have either fully recovered or presumed fully recovered or are isolated and recovering at home, treating their symptoms on their own. The Board of Supervisors, a couple of notes on some of the things the board will be considering next week on Tuesday. Next week, the board will consider a proposal for the use of $1 million in federal CARES Act COVID-19 relief funds for a program called Housing for the Harvest. And they would authorize in this proposal an agreement with the Community Action Partnership of Kern, or CAPK, to serve as the local administrator of this program. This program is designed to provide temporary hotel housing options for essential farm and food processing employees who are either COVID-19 positive or have been exposed but do not require hospitalization. The program will provide safe and suitable places for these individuals to isolate to mitigate the spread of COVID-19 among their households and in the community. This program is in line with the state's recently announced blueprint for a safer economy to identify a plan for potential risk areas in an effort to reduce case transmission and allow our county to advance to a lower tier more quickly. This program will provide increased outreach to these workers, making them aware of these services, and will involve increased testing of this population of residents. The program continues to build on our local efforts to date to serve disadvantaged populations, such as our mobile testing program, and it includes partnerships with the Kern County Farm Bureau and United Farm Workers, and we thank them for their partnership. This Housing for Harvest program is a partnership with the state where they will book hotel rooms for those agricultural workers requiring isolation for up to 14 days. The state's going to be covering 100% of the cost for the hotel rooms. As mentioned, CAPK has been identified as the local administrator for the county, and they will coordinate with the state to manage this program. They'll serve as the primary point of contact with these workers. They will verify participant eligibility, coordinate with the state for room reservations, provide transportation to the hotel site, provide meals, and general wellness checks. And we anticipate the county's local allocation to this program of $1 million will support the efforts of CAPK and serve just under 600 individuals in this category in our community. Secondly, the state's adopted budget, recently adopted budget, includes an allocation of $500 million in CARES Act COVID-19 relief funding for cities. and for those cities to address public health, public safety, and other impacts of COVID-19. The city of Bakersfield has received some of this funding, and on August 12th, the Bakersfield City Council approved the City of Bakersfield COVID-19 response funding plan, which outlines their intended uses of this funding. City and county have been working closely together to utilize this CARES Act funding through programs that have been established like the Kern Recovers program to assist the city to quickly and efficiently implement portions of their adopted COVID-19 response funding plan. Today, I'm pleased to announce that the Board of Supervisors will consider a memorandum of understanding with the City of Bakersfield that would allocate an additional $5 million in economic assistance for small businesses and the nonprofit community that will be funded through the Kern Recovers program. The city is allocating an additional $3 million in new small business forgivable loans and an additional $2 million in grant funding for area nonprofits. The additional $3 million in assistance for small business will specifically target those small businesses physically located in the Bakersfield city limits. The additional $2 million in nonprofit grants will target nonprofits operating within the Metro Bakersfield area. In both cases, the county will be responsible for the administration, review, awards, and ongoing management of these program funds. By utilizing the existing county program design and infrastructure, the city and county working together are avoiding duplicative efforts, expediting program delivery, and maximizing efficiency and use of taxpayer resources. And I want to thank the City of Bakersfield, the mayor, the Bakersfield City Council, and the city manager of Bakersfield, Christian Clegg, for their leadership and partnership with the county in moving this vital funding out to small businesses in the nonprofit community here in our area. It's tremendous help for them, and we thank the City of Bakersfield for this generous contribution. I want to say a few things about what Matt spoke just now about in terms of the new county tier system and how counties are being judged, the plan for businesses to reopen, when, how, that's all done. On March 19th, Governor Newsom issued Executive Order N3320, ordering all individuals in California to stay home with limited exception, and reduced or stopped non-essential businesses from continuing operations. These actions were aimed at the time specifically on flattening the curve to avoid the catastrophic failure of our hospital and medical systems. There have been numerous changes made by the governor over the past several months: new orders, directives, businesses allowed to open, then ordered closed again, mandates to wear masks, the fluid and constantly evolving rules and criteria for our business community and the county, all at great stress, time, and expense for not only our business community, but our county. Counties are doing the work here, Governor, having to continually change our course and change our priorities, and our business community and our children are bearing the full brunt of these actions for 7 months now. Counties up and down the state are literally being whipsawed by these constant changes. Changes being dictated by the governor and his public health team with very little to no involvement of counties in the decision-making process. Counties are literally being given a heads up, often with little detail, just hours before the state makes a new announcement on what the governor will now require of us. And they continue to move the goalposts on us, both by orders they're giving and by their words. I want to thank the residents of Kern County and all of those organizations in our community who have partnered with us over these past months to navigate this extraordinary exercise we've undertaken to deal with COVID-19. The work we have put in is paying off. It is working. The curve is being flattened. The work, time, money put into maintaining our hospital capacity is showing results. Today, hospitalization rates are low, and bed capacity, particularly ICU capacity, is high. At great expense, we've maintained readiness for an alternative care site at the fairgrounds for months now. At great expense, we've significantly boosted critical ICU bed staffing, and we're sustaining that staffing level. At great expense, we've set in place massive testing capacity all across this county so that people can be easily tested for free, whether they have symptoms or not. We poured tens of millions of dollars into the local economy. We've implemented many programs. I've outlined a couple here today, assisting the most vulnerable among us in our community to provide them with critical assistance, financial and otherwise. At great time and expense, we've stepped up and stepped into the issue of SNFs, the egregious problem we're having with SNFs and associated with SNFs facilities that are supposed to be regulated and managed exclusively by the state of California. We're making strong progress on our case rate numbers and our testing positivity rate, and we're looking to move into the state's red tier as soon as possible. And Matt talked a little bit about that. Moving into this tier will allow more of our local businesses to open just a bit wider, and that matters. Following the governor's announcement on September 2nd, assigning the state's 58 counties to one of 4 different tiers that outline a slow, I quote, slow and stringent process for opening that the governor stated would be based on case rates and testing positivity rates, the governor again has moved the goalposts on counties just last Sunday. The governor has announced that he is now going to penalize counties like Kern, whose overall testing rate, the total number of people going in for tests, fall below the state average testing rates across all counties. So now, in addition to case rate and our testing positivity rate, we are now being judged also by the numbers of people being tested. In his administration's announcement to counties on Sunday, counties that fall below the state average testing rate will have their case rate numbers artificially inflated as a penalty for people not getting tested, which, of course, is a total voluntary action. This, despite all the investment our county has made, all we've done to build testing capacity here in Kern, which I would argue rivals virtually any other county in the state with what we've done and the work that we've put in. This penalty is reflected in what the state is calling the adjustment for tier designation, where the state takes our actual case numbers and arbitrarily adds additional percentage points to it, making it higher than it actually is. And you can follow this information at covid19.ca.gov. It's on their website. You can see our actual case rate. You can see the adjustment for tier designation. You can track our testing positivity rate on the state site. This arbitrary directive only makes an already very slow process for additional limited reopening of businesses and getting our kids back in school even slower. We don't know what it is intended to achieve other than to keep our economy locked down the way it is for a longer period of time and to keep parents out of work and their children out of the classroom longer. We simply cannot force people to go get tested, even though we have the availability that we do. Today, Kern County is on the precipice of moving into the red tier. Today, our actual average daily case rate, unadjusted, is 7.74 cases per 100,000. We need to be at 7 or below to move into the red tier. Today, our testing positivity rate is 7.6%. We need to be at 8% or below to move into the red tier. This is good news. The governor's added an additional 1.6 percentage points or 1.6 value points to our case rate, raising it to 9 today, as it stands today. Governor, Kern County joins other counties in demanding that you stop moving the goalposts on us. We demand that you work more closely with us. We are demanding that you not arbitrarily assign a penalty because our population is not going in to get weekly tests. We are demanding that you not continue to make this situation any harder on our business community and on our kids than it already is. We are demanding that you reevaluate and change this course of action to reflect our actual numbers. I understand that the governor has a big job and it's difficult. I'm sure he's doing the very best that he can. But Governor, your public health team needs to work more closely with counties. We need to better understand these directives, why they matter, what the intention is, what the link to slowing the spread, stopping COVID is. We need a better understanding of that. We don't understand why you're penalizing us for a voluntary action that we have very little control over, even though we have ample, more than ample testing capacity for folks at any given hour, free of charge, all over the county. Federal free sites, state sites that are free, county-sponsored sites that are free, and 50-plus other places that people can go in the medical community here locally to get tested. Ample. Please reconsider these changes that you've made, capacity and the investment that we've put in to our to reopen are business for kids back into the class, which matters to pull in a brand test. We will be working with other counties across the state in the days and weeks ahead to demand that we get changes in this area. We want our actual numbers to be the numbers that we are judged by, and we will be working very, very hard as a county, working with other counties in the state. Virtually every other county is in the same boat, and I know are frustrated with how things are transpiring. So with that, we're happy to answer any questions you
There are assignments to get onto that, and then we'll come back and ask for any follow-ups. So starting at the top of the list, I believe we have Sam Morgan with the Bakersfield Californian on the line.
Again, my question is to Mr. Alsop, and I'm wondering what is the level of frustration? It seems like it's very high with the state at this time, and can you go into, what made you come out with such a strong statement today, asking the state to change what they've been doing?
Thanks, Sam. We'll have Ryan respond.
Sam, on March 19th, the governor took actions specifically aimed at flattening the curve and addressing hospital capacity. And since March, over the last 7 months, there have been numerous changes, businesses reopening, closing, new directives provided to counties. We were on a monitoring list. There were changes to that monitoring list. There were statewide closures of business, variations provided to counties. On September 2nd, he came out and provided this new revised state plan, the blueprint for a safer economy. While we were frankly grateful to see that there was some specificity and some detail and better planning for our small businesses, for our business community, for our parents and their kids in terms of understanding where we had to be in order to begin reopening in some capacity, to begin putting kids back into the classroom, at least the K through 6 population. That was on September 2nd, and the goal was to get our case positivity rate to 7 or below, and to get our testing positivity rate to 8% or below. Sunday, he gathered, his team gathered the counties and added a change to that, and threw in this testing rate, overall testing rate, and added a penalty to counties, artificially inflating case rate numbers for counties that were testing below the state average. That was new. That was not something that was rolled out on September 2nd. There was no clarity on that. There was no discussion that they were going to be providing a penalty and how a penalty like that would be implemented. And so that's the source of my frustration, the continuing movement of goalposts for counties. Kern is not alone. I have been on the phone with many other counties in the state, with the California State Association of Counties. We all share the same frustration. So the frustration you're hearing from me today is really about these constant changes that keep being made. The governor also announced there are some equity criteria that they are working on, that they want to bring to bear on this new system that there's no clarity on, there's no direction on, we have no understanding of at this point. We don't know how that's going to impact us. We don't know what the governor's going to do a week from now or 2 weeks from now, but he's demonstrated since March 19th that understanding that this is a fluid process and there needs to be changes that are made. All of the changes that keep getting made are being done by the state. They're the smartest people in the room. They're making these decisions, and then they're letting all of us know, and all of our public health officials, all of us county leaders know just hours before they make their announcement what they're going to be doing. So my frustration is they are not working the way they should be with counties. We want to see better collaboration. We want to be involved more in how these directives are put together. We want better understanding before they're announced. We want some discussion on it, and we don't understand why the governor is penalizing folks in counties across the state for a completely voluntary action by residents to go get tested. I'm not sure how we force people to go get tested. The only thing that we're able to do is provide ample opportunity in this community, a number of different ways folks can get tested so that it's easy for them to do so. And that's the position that we've held for months now here in this county. So we're frustrated by the constant movement of the goalposts here. We need certainty. We need that certainty because that informs what we do as a county. We're constantly, not just Kern, but other counties are constantly having to pivot, change priorities, courses of action to focus on one thing or another. It was hospitalizations at first, and then it was something else, and it was masks. And then, now we're not only having to deal with our case rates and our testing positivity rate, which those numbers are going down, but he's throwing in this arbitrary new criteria and number where we're getting penalized because we're not seeing droves of people, 1,000 more people a day rolling in to go get a test, whether they need to or not. And we just don't understand what that has to do with the end goal here. So we're frustrated, and I think we have a right to be frustrated, and I'm expressing that frustration. I think I'm expressing the frustration of our Board of Supervisors in this, and the frustration that all of our small business community feels, and parents and kids in this community that need to have clarity of direction and some certainty on what the plan is and what we need to do to meet that plan. I'm lucky. I'm a government employee, and I've got a job, and I show up for my job, and I don't have to worry about it like people in the small business community worry about their jobs. People that are working for those small businesses have to worry about their jobs. This is about them. We want to see them get open as soon as possible. No matter what tier you're in under the governor's new framework, even in the best tier, which is this yellow minimal tier, which we are likely months away from achieving, businesses are still not fully normal. They're only open, bars, restaurants, churches, other things like them, indoor activities, only open at 50% capacity. This is a long road. So making this long road harder on these communities is unnecessary, and we want better coordination and communication by the state going forward, and I hope that answers your question, Sam.
Okay, thank you.
Our next outlet is Channel 23. I believe we have Austin on the line.
Hi there, guys. Mr. Alsop said there are many other counties that are frustrated. Which ones was he talking about? And on top of that, given the adjustment for tier designation that you were talking about, Mr. Alsop, when do we anticipate Kern will be moved onto the red tier?
Austin, will have Brian respond.
I don't know when Kern will be moved onto the red tier. We're on the precipice of moving onto the red tier. We have to maintain a case rate of 7 or below per 100,000, and we have to achieve an 8% testing positivity rate or below. And we have to maintain that position for a 2-week period, 2 consecutive weeks, in order to be qualified to move to the red tier. Our numbers are going down. They've been going down over the last several weeks, and things are looking good. This new announcement by the state slows that process for us. They are adding additional points to our case rate artificially in a methodology that they came up with that doesn't really have any scientific basis, where they are artificially increasing our case rate. So we're around 9 on our case rate as the state adjusts it. 9 is close to 7. So we're going to be continuing to work hard. Our community needs to continue to work hard to do all the things that we've been talking about all along, so that we can get more businesses open. And in terms of counties, all of them, all the counties, you can call around. Talk to the California Association of Counties. They have ongoing discussions with the administration. They express on behalf of counties the frustration that we have, the issues that we have. We've been doing this work for months now, but I can't think of a county who is not frustrated with the process, whether they'll tell you officially or not. That's my take on it in conversations, in conference calls, and in calls with our state association.
Thank you, sir.
Our next outlet is the Mojave Desert News. I believe we have Jack on the line. Star 6 to end.
Hi, I had no questions today.
Okay, great. Thanks, Jack. Our next outlet is Channel 29. I believe we have Aaron on the line.
Hi, Megan. Yeah, Erin Rooney here, Channel 29. My first question is just related to, we saw LA County kind of cancel Halloween and then go back on that. I guess just for Kern County, is there any plan of action when it comes to Halloween, or any advice or anything that you're asking the public to do after trick-or-treating like that?
So, Aaron, I believe Ryan's going to respond to that one first.
Announcing that you're canceling Halloween is a fairly bold statement to make. I don't know how you do that. You can't cancel Halloween. Are we going to cancel Thanksgiving and cancel Christmas? I'm not sure what that means. What we continue to tell people to do is to use good judgment, use good and practice good public health practices in a rigorous way. Wash your hands, avoid crowds, distance, wear a mask when you're going into places where you can't effectively distance, where you're around unfamiliar groups of people for a fairly long period of time, indoors, clean surfaces. If you are 65 and older, if you have underlying health conditions, diabetes, hypertension, heart disease, any serious respiratory or autoimmune disorders, you need to really take care and pay attention and to protect yourself to avoid hospitalization or the risk of actually dying from complications due to COVID. So our message has been the same from day one, and it hasn't changed. We're asking people to use good judgment. At some point, the responsibility of government ends and personal responsibility begins. We are in that phase where people need to take personal responsibility and do all the things that we've been talking about to protect themselves and others.
Thank you.
Our next outlet is Channel 17. I believe we have Eitan Wallace on the line.
Good morning, everybody. Thanks, Megan. So, as Ryan mentioned, since March, the goal was to lower the curve, flatten the curve, rather. It's always been, at least at the time, it was supposed to be about the hospitals, ICU, and hospitalization rates. How is that looking today?
Eitan, we're going to have Matt respond to your question.
Thanks.
Morning, Eitan. Our numbers are doing well. We are trending down. Our focus has been to ensure the hospitals remain healthy and there's available beds. As of September 8th, countywide, we show 872 available beds. We show 47 available ICU beds. We have 87 hospitalized COVID patients and 26 in the ICU. Those numbers are at or near the lowest we've had in quite some time. So the numbers are trending down, and our resources in our hospitals are available. Does that address your question, Eitan?
Thank you, Matt. I appreciate that.
Thank you.
Just to tag on to what Matt said, I would add that if you're looking for the graph, or if you're a member of the public, it's available Kern County Public Health dashboard, and you can see the lines that Matt's referencing there. That is all of the outlets that we have on the line today. I'm going to go back up to the top and make sure, one, that we didn't miss anybody, and two, if you have any follow-up questions. So, Sam, did you have any follow-ups that we need to address?
No, I'm all good. Thank you.
Okay. Austin with Channel 23. Anything else we need to circle back to?
Hi there. Do we know yet if Labor Day has affected the number of cases here in town? If not yet, when should we expect to see differences, if there are any?
So, Austin, can you repeat that one more time? I want to make sure that I couldn't hear there was a word in there that, did you say Labor Day? Okay, so it's too soon to tell. We need 2 weeks from the date to see if there's a spike related to that.
Understood. Thank you. And just the last thing, we've been asking about the public health releasing the ages of people who have died. We're wondering if you have any updates as far as whether or not that information can be released.
I'm going to have Matt respond.
Good morning. So we are still awaiting the feedback and the advice from our HIPAA statistician. We don't have any information yet. As soon as we receive that approval, our hope is to get that information up on the website as quickly as possible, but we just haven't heard back yet.
Appreciate it. Thanks, Matt.
Okay, just circling back, Jack, did you have any follow-ups? Okay, we'll keep going. Aaron with Channel 29?
No, I did not.
Oh, thanks, Jack. Aaron with Channel 29, any follow-up questions?
Yeah, just one more question. What makes someone presumed recovered?
That's a question that Kim's going to answer. Give us just a second.
No worries, thank you.
Hi, Erin. Good morning. People on our dashboard fall into the presumed recovered category if they are more than 30 days outside their specimen collection date, and we have not otherwise been following up with them. What we have found with many of our patients is that they are following up with their healthcare providers, and those healthcare providers are releasing them off of isolation. And so since we at the health department are not part of that decision-making process, we are entering them as presumed recovered because we as the health department haven't gone through the process with them, and we cannot ensure that they have met the CDC's criteria for discontinuing isolation. We are presuming that their healthcare provider who is following up with them is following CDC's criteria and is releasing them accordingly. Thank you.
Thank you.
Okay, and Channel 17, any follow-up questions?
Yes, quickly, just I know that both Matt and Ryan discussed briefly students and kids. Matt, in the past you've said, and correct me if I'm incorrect here, that there's been at least 2 applications for school waivers. Do you have any update on those school waivers?
Thanks, Eitan. We'll have Matt give you an update.
Thanks.
Eitan, yes, we do have some updates. There are now 15 schools that have submitted complete waiver applications that we have approved and the state has approved. Those 15 are on our website and on the state's website. There are additional, I think we have 4 other applications pending for review.
Thank you.
Okay, one last round. Any follow-up questions? Okay, that's it for today. We'll see you next Thursday. Please stay safe.
And you've been listening to an update from county officials and public health officials on the latest cases and reopening guidelines in Kern County. Just to sum up for you really quickly here, we had 10 new deaths that were announced today in Kern County and 69 new cases. All but 2 of the deaths that were announced today actually happened back in August. So we have had 2 deaths from COVID-19 here in Kern County since September. Another big takeaway from today's news conference, if you missed it, County Administrative Officer Ryan Alsop calling out the governor, asking for more defined guidelines on how we will be reopening and asking the governor to, quote, stop moving the goalposts. Kern County is now in the bottom of 4 tiers across the state and those determine which businesses can open and how tight restrictions are. He specifically called out the state health department and governor for adding percentage numbers onto our percent positivity rate here in Kern County because not enough people are getting tested. Our overall testing rate is lower per population here in Kern County than it is average over the entire state. And so because of that, a certain number is added on to our percent positivity rate, moving us farther away from the mark where we would be able to move up a tier. So right now we're in the purple tier, the lowest tier. Our next step of reopening would be moving into the red tier. Now, county health officials did say we are getting closer to that, moving into the next tier, but we are not there yet. We are still in that lowest tier. We're going to sum it all up for you today on 17 News at 8, actually, which will happen after football, and we'll have much more on the news at noon as well as tomorrow morning on Sunrise. You can also download our 17 News app to get the latest on the coronavirus pandemic sent directly to your phone. For now, from the 17 Newsroom, I'm Maddie Jansen. Thanks for joining us.